Thank you for joining the UI Center for Human Rights for the third webinar in our series, Human Rights and COVID-19, Refugee and Immigrant Rights. My name is Colleen Opal and I'm the Program Coordinator in the UI Center for Human Rights. Now I'll introduce our first speaker, Dr. Claudia Corwin. She is Assistant Clinical Professor in the Department of Internal Medicine, Division of Pulmonary Critical Care and Occupational Medicine, and holds a secondary appointment in the College of Public Health.
Great, thank you, Colleen. So everyone, thank you for joining us today. So as you know, the COVID pandemic has rocked the lives of nearly everyone residing and working in the United States. There are new social challenges, there are new financial challenges, there are looming physical and mental health challenges for just about everyone in some way or another. No one seems to be completely spared. Most unfortunately, the pandemic is also a unique context in which social and health-related disparities are again starkly evident. Take, for example, the new dictum that farmers are essential workers. Well, in the US, many of our farmers are migrant workers and immigrant workers, often undocumented. As a previously invisible population is now recognized to provide a service our country simply cannot do without. Our meatpacking employees are being ordered back to work. While on the surface, one may think that this has risen the social status of these populations, they are now forced out of their homes, unable to shelter in place with their families, with no compensatory promise for healthcare or social safety nets. For many of our undocumented individuals, they are now visible as they move about in their communities that are, for the most part, staying home and off the roads. The New York Times and other papers have published multiple pieces that have begun to reveal the unique experience of these workers during a really unique time. Stories working while ill in meat processing plants, stories of continued risk for deportation while working in the fields. We are also very importantly and acutely aware of the challenges our refugee populations are experiencing. Language barriers are leaving individuals in the dark and frightened. Racism has again risen its ugly head, this time with disturbing anti-Asian rhetoric included. It is crucial that we understand the experiences of our refugee, migrant, and immigrant populations, that we hear their stories, and that we process their stories in a truly meaningful way. So today, first, we are going to hear from Mira Youssef. Mira is the Executive Director of Monsoon Asians and Pacific Islanders in Solidarity, an organization serving victims and survivors of domestic violence and sexual assault in Asian and Pacific Islander communities in Iowa. So Mira.
Hello, everyone. So again, my name is Mira Youssef, and I am the Executive Director of Monsoon Asians and Pacific Islanders in Solidarity, formerly called Monsoon United Asian Women of Iowa. We are a community-based organization led by API women who are working with victims, survivors of gender-based violence from the API communities in Iowa. I will mainly be sharing the experiences of the victims, survivors that we are assisting, community members that we are in contact with, and of course, our staff. I also want to provide the theoretical foundation of our community practice. We are a feminist activist organization deeply rooted in anti-colonialism, anti-imperialism, intersectionality, and social justice and social change. So therefore, I usually will start with the macro, which is our community has basically had this experience an anti-Asian and Asian American racism and xenophobia, which is not a new phenomenon. It has been part of American history for a long time, and we have seen it manifest against different Asian American and Pacific Islander communities in many ways over the years. But as the coronavirus pandemic escalates, we have seen more harassment, discrimination, and even violence directed at our communities nationally. So experiences of racism and xenophobia affect how our community will respond to a crisis. So for example, if individuals from our community may avoid seeking medical help when they have a fever, because of the particular stigma of being Asian and testing positive for COVID-19. Also, individuals from the immigrant and refugee communities who work in the meatpacking businesses or any manufacturing plants are likely to catch the virus due to the lack of PPE or protective personal equipment and social distancing. So as a result, an individual from our community who has symptoms of the virus might not call in sick because of the fear of losing the job. This also applies to owners of Asian restaurants and even nail salons. The lack of employment or income may also affect their ability to seek medical help due to the financial hardships. So people are very concerned about their finances. The majority of our clients at Monsoon live with very limited budgets. They are relying on unemployment claims and the stimulus payment to pay rent, mortgage, and take care of their families. We have heard of different issues involving unemployment claims, ranging from the confusing application process to the slowness of process claims. One of our clients had been waiting for payments for 3 weeks. In addition to that, community members who were seeking employment have found that employers are delaying hiring, so their employment opportunities are limited. So for Monsoon staff, who are mostly women, basically right now we are working from home. So our struggle is balancing work and caring for our children. So although we are a feminist organization, we are really seeing this contradiction because our staff are the main caretakers of our families, and then their male partners are still unwilling to share the responsibility of childcare. So this has become especially apparent during this pandemic. But specifically for victims, survivors of domestic violence, we have seen cases where ex-partners use COVID-19 as a reason to gain full custody of their children. Because of the need for social distancing, there may be an increase in violence for victims of domestic violence who are still in an abusive relationship. Similarly, with child sexual abuse victims may not have anywhere safe to go due to living with their harm doer. But on a good note, organizations like us, organizations serving victim survivors of sexual violence, domestic violence, stalking, dating violence, and human trafficking, we are still providing services online and have been really flexible about continuing the work to ensure that victim survivors are safe. One thing that I am specifically asking from community leaders is to be careful in making statements such as there has been an increase of COVID. Just an example, there has been an increase of COVID-19 in the immigrant and refugee communities, because such statements can have violent repercussions to a specific community. For example, the API communities, due to racism and xenophobia. So I think that's it for me. Thank you.
Our second speaker is Manny Galvez, who is the founder and writer for LULAC Iowa, an online magazine with stories, news, and events relevant to the Latino community.
Okay, thank you. I hope everybody can hear me and see me. And thank you for the invitation. So first, I want to talk about the Latino community. For sure, many people, they know about the Latino community in Iowa, but some people, maybe they don't know some details about the Latino community. And I think it's important to share with you before I start. And I divide this like a participation in 3 or 4 basic parts. And the first is like what is the Latino community? What happened or how the COVID-19 come to the Latino community? What is the needs, struggles, and how we respond to this situation so far as a community. And first, the Latino community in Iowa, we need to understand like we are first and second generation. So why it's important to say that? Because we are a community, like still we have many members in our community that they don't have documents. It's so complex, the structure inside the Latino community, because you are going to find like many times inside the families, some people, they have documents, so they are citizens, and another part of the families, they are not. So this is just kind of like, I would say, the structure of the Latino community. And again, the language is another issue. I assume like I just know for us, for many immigrants and refugees is the same. And and basically, this is another thing like we need to understand when we talk about the Latino community. So when we receive this situation about the pandemic, the COVID-19 in Iowa, Again, we thought that the response from the government to attend the minorities that was so late. For example, in the Latino community, for at least the first month, we didn't have the government information in Spanish. Some expressions, some organizations start to do some to provide information in Spanish. But after 1 month, we start to hear that the government was providing interpretation for the conference every day from the governor. So that was so important because we didn't know what was happening. That was really hard to know who was helping the people because the language barrier. So that was the first thing we face in this pandemic situation. Now, after this 5-6 weeks working with the Latino community, because of my role, as a media, and also another thing, we don't have one, I would say a statewide organization. So you are going to find small organizations that try to help the Latino community. So even us as a media, as a news media, many Latinos and Latinas call us to find answers, to find, and in this case, reference what they can do, phone numbers, information for everything. So, for example, what I have found so far, we need a specific information about how they can apply for the support the government is giving to the people. They don't know if they can qualify for example, for the stimulus check. Again, why? Because sometimes the families that they buy, some of them, the spouse could be a citizen, but the husband maybe is not. So this is kind of a really complex situation for many Latino families. And another thing is, again, as I mentioned in the beginning, many Latinos that are first and second generation in Iowa, they don't know about labor rights. So I have found many situations in the workplaces, they don't know if they have rights or not, and they don't know how respond. For example, when the manager was telling them they had to show up in the place to work, even when they know some co-workers, they were tested positive with the COVID-19. So this is situation we found. Another situation is that, as you may know, if you are in a process to become a citizen, this rule about the public charge, you cannot receive a public assistance. So even when supposedly you can receive in this moment, many families are afraid. So if you don't have Social Security, even when you pay taxes, they are afraid to receive assistance, which means sometimes we have many problems right now with food for the families. Why? Because even when some food banks, they are available to provide food without the Social Security, and other people is basically they don't know where to go or they're afraid. So this is another thing. And other issue we found is also another minority. So even maybe the rest of the population, the full population is having is the domestic violence and the sexual harassment in the workplaces right now. So I received a few calls about this issue. So, and again, when we have all these situations, how we respond as a community for us is try to do collaborations with as many organizations we can find to provide food, to provide information, basic information about how we can respond, what can you do if somebody in your family is tested positive, and try to translate as much as possible all the news into Spanish. This is how I've been responding to them, to the pandemic. And the most important, I want to mention, we were working with the University of Iowa. We create videos, flyers, and I can tell you so far, all these videos, all these materials, they have been more than 30,000 views through the social media. Also, we partner with an accounting business. So the businesses in the minority, they know how to apply for the grants, for the economic support. So basically, this is how we have been responding to this situation. And just my last comment is that, again, this situation, the pandemic, the COVID-19 is exposing the segregation, is exposing the system is not working for the majority of the people. And I would say, like, to start, this is kind of like my intervention, and I hope that was useful.
Thank you, Manny. Our next speaker is Bijou Maliabu, the co-chair of the Congolese Health Partnership, which is a collaboration between the College of Public Health at the University of Iowa and the University of Iowa Healthcare, and collaboration with the Congolese community in Johnson County to provide education and resources to overcome healthcare obstacles.
Hello, everyone. My name is Bijou Maliabu. I am one of the co-chair for the Congolese Health Partnership. I will be sharing a little bit about who we are, what we do, and how we have attempted to address barrier in the community, especially the Congolese refugees and immigrants. The Congolese Health Partnership, the Congolese Health Partnership is a partnership between the Congolese Public Health at the University of Iowa, the leaders of the Congolese community in Johnson County, Iowa, and the University of Iowa Hospitals and Clinic. This group started about 3 years ago with Dr. Will Story from the College Public of Health as the vice chair, with the mission to improve the health and well-being of an evolving diverse community by building bridges through mutual education, empowerment, and expansion of resources. Our goal is to help immigrant and refugee families by providing education and support to help them overcome healthcare obstacles, transportation, languages, culture, and many other aspects. Also to build a relationship between the providers and the refugee and immigrants community by learning about each other and to better understand the culture and the tradition, which is very helpful when providing and receiving services. Right now, our focus is to provide as much information to the community in multiple languages about the coronavirus as COVID-19, and to provide information about available resources, because we found out that the people in the community, especially the Congolese refugees and immigrants community, face barrier and misinformation, which brings confusion from many community members due to limited English skills. There's a lot of information in the media, but it is in English, and there is a need to communicate this information in other languages so everyone can be on the same page, since this virus is hitting people of colors and all kinds of people from all over the world. The Congolese Health Partnership has created 3 videos and audio series called Protecting Our Community, which cover topics such as, what is coronavirus? How can we prevent coronavirus? How do we seek care for the coronavirus? These videos are available in multiple languages already, and you can access them through the YouTube channels, our YouTube channels, our websites, Facebook, and we also have shares this information in so many languages through WhatsApp with different groups that speak these languages. Some of our board members have participated in webinars, interviews with the University of Iowa International Program, where we talk about the effect of the coronavirus in the community, especially that affecting the Congolese immigrants and refugees. Some of our board members have been on Daily Iowan, and they also have served as panelists on a Zoom webinar like this one. And some were invited to speak at the Johnson County Public Health conferences. So far we've been just sharing information and try to share as much information in the community in different languages. Those languages right now are French, Swahili, Lingala. We have some videos in Spanish. We have some video in Arabic and Kinyarwanda, I believe. Other members like me are helping within the community by distributing food to people that need it, by translating documents like people trying to apply for food stamp, trying to apply for medical assistance, trying to apply for unemployment, because these are barriers first for the language, and also it's very hard right now. I'm also helping some family who actually are directly affected by the virus by checking up on them to make sure they are practicing the social distancing, to see how we can help out with the bills by providing them with resources of who's helping, and calling and also calling their mortgages to see if they can reduce the payment, or calling the electrical company so they don't get shut down, because I understand right now they won't be able to shut down things, but you have to contact these companies. And because of the language barrier and because of the misinformations, people don't know or are not aware of that. So that's exactly what we're doing. Also, we are planning to host a Facebook Live on May 2nd at 11 a.m., which will cover learning about how to prevent and manage COVID-19 and how and where to access community resources in this time of crisis. We are also working with different organizations to find a way on how to help and protect our community from the coronavirus. Those organizations, some of them are the African Community Network, the Johnson County Public Health, the University of Iowa Hospitals and Clinics, where we work with medical doctors and healthcare providers, trying to find more information so we can translate those information in different languages and we can share with the community who speaks those languages. I will work with different leaders in the community, the police department, and so on. So right now, that's really what we're doing. Thank you.
Thank you, Bijou. Our next speaker is Daniel Hoffman-Zanell, who is the CEO of Proteus, a nonprofit organization that provides immigrant, minority, and low-income communities with health, educational, and economic opportunities.
All right, good afternoon, everyone. I'm Daniel Hoffman-Zanell. I'm the CEO of Proteus. I've been with the organization for this time around a little over 8 months, but in total I've been with Proteus for a little over 7 years. But we are a multi-state nonprofit in Iowa, Indiana, and Nebraska, and we provide healthcare, education, workforce development, occupational health hazard training, and other supportive services to farm workers and other agricultural workers across each of the 3 states. We began in 1979 and have continued to expand programs and services over the last 40 years. So kind of a current state of what we're seeing across Iowa, specifically within the farm workers that we serve. There are many farm workers that are working right now. We're gearing up for the bulk of when the migrant farm workers start to arrive, which is usually around late May, sometimes earlier May into June, and they stay here and work for a few months, some stay longer, but the bulk of the migrant farm workers are here in June, July, and August. Some employers are delaying their work a little bit just to give them some additional time to prepare for their workforce, while others are thinking about bringing their workers earlier, especially H-2A workers who oftentimes are coming from Mexico to give that 14-day quarantine. So that's what we're hearing from some of the employers that we've been in conversations with. We've heard a lot of concerns from many of our patients who have family members or partners that work in food processing and just have those concerns of potential exposure. Many of our farm workers have to make the decision and choice to either work even while they're sick or not get paid if they're not working. And so that's definitely something we have been trying to advocate to employers to offer paid sick leave. And then some are also not eligible for governmental assistance, as was shared earlier with some of the other presenters. And another thing I wanted to highlight that's also been shared is just the misinformation out there. So we've been trying to provide accurate, timely information to the farm workers that we serve. So some of the things that we have been doing, we have been gearing up to provide additional supportive services to migrants as they arrive. We do have some funding to offer some rental assistance, groceries, utility assistance, transportation to migrants as they arrive, especially up until they get their first paycheck. After watching what's happened in the food processing industry, we, a few weeks ago, started to proactively reach out to the agricultural employers and crew leaders to encourage them to implement some best practices and other recommendations in order to keep their workforce safe and to limit exposure as much as possible, including offering paid sick leave and offering more sanitation stations and increased restroom breaks and access to washing hands, those sorts of things. But we do have some concerns of some employers potentially not taking some of these recommendations into practice, and a few of them also provide housing, and one in particular offers housing in a communal living setting, which right now OSHA requirements are only 3 feet away, the bunk beds have to be, but I do know this employer is trying to figure out how to increase the space between bunk beds, but still we have a lot of concerns. We've transitioned to a telehealth setup, which is really exciting for us and for our patients to be able to access services from your home and to limit exposure and contact from each other. So that's something we rolled out a few weeks ago, and it's been going really well. We've been also going to them. So many of our patients have prescriptions that need refilled and need additional prescriptions. So we've been going to them. We're set up to be mobile in the beginning before this. So we had the great operations set up to respond appropriately to this current pandemic. We've been offering testing. And we also launched a campaign a couple weeks, 2 weeks ago today, face masks for farm workers, because we had heard from many farm workers that they needed face masks. And so we launched a campaign 2 weeks ago. And in 2 weeks, we've received over 1,000 face masks from community members. So that's something that we've been really excited about, but also are encouraging employers to offer PPE and face masks on job sites as well. But when we do offer the face masks, we'll include education materials with photos of face masks and additional information on COVID-19. One thing that's been really helpful has been proactively reaching out to our patients, especially ones that have chronic conditions or might be a more risk for additional complications related to COVID-19. And that has really paid off. Many of our patients, and I think many anecdotally through conversations with other partners, many of our community members aren't reaching out when they're in need, or they feel like other families or other individuals might be in greater need. But thankfully, we have proactively started to reach out to them. And just last week, because we had conversations with a couple patients, they weren't going to call us based on the symptoms they were presenting, but our provider determined that they would likely need a COVID-19 test. And so we went to them, did the test, and it came back positive. So thankfully, we did reach out to them and get them in connection to care as soon as possible. But we're just in the process of gearing up for additional testing. We have limited tests available right now, which is, I think, the case across the entire state. But hopefully with additional time, we'll get some additional tests and be able to offer that across the entire state. And then one thing that recently came up is a new partnership between Alexito, American Friends Services Committee, and Proteus. We've received some funding from the Community Foundation of Greater Des Moines and Mid-Iowa Health Foundation to offer immigrant families for right now in Central Iowa who aren't eligible for governmental assistance access to some basic needs support. So that is rolling out this week, which is really exciting. And then we also applied for an additional $75,000 to help provide support to other immigrant families who aren't eligible for governmental assistance in other parts of the state as well.
Okay, thank you, Danielle.
First, I want to express my gratitude to our amazing speakers today. Thank you so much. From what we've heard today, it's clear that our immigrant and refugee communities have tremendous strength and resilience. However, we also know that their struggle during this pandemic are uniquely difficult. And it truly lays bare the health and social inequities that we know have always existed, but are now so much more visible during this crisis. Clearly, immigrant and refugee communities face very specific risks and barriers during this time such as access to information, trouble implementing preventative measures and safety measures, being essential workers, many of them, economic stress due to loss of income, and social safety nets. But as our speakers have all made clear, these communities are strong despite their challenges. They are responding in powerful ways. They are educating one another about COVID, they are advocating in the workplace, and they are providing support through all kinds of mutual aid and cross-collaboration. These stories have deepened our knowledge and hopefully our ability to understand how immigrant and refugee communities are struggling during these COVID times. It has been said over and over again in the past that our most meaningful social changes in this country came about during or following times of war or national tragedy. But this is not something that we can count on. Hopefully, after today's session, we will all internalize these stories and be further propelled towards working towards closing disparity gaps that this pandemic has laid so starkly bare for Iowans to see, for the entire country to see, and really for the world to witness. So on this note, I would like to turn it back to Colleen for some question and answers. Thank you.
One question that we received is particularly in response to what Manny was mentioning about the inability of people seeking citizenship to use public assistance. So the question is, what organizations can those individuals seek public assistance from that would not endanger their path to citizenship?
Well, thank you for the question. Right now, we are trying to be so organic in Iowa, and I can tell you, for the people that they don't have this possibility to have like assistance from the government, we are trying to find ways to help people in different ways. For example, I know like in Iowa City, some organization, they put together more than almost like $30,000, and they were supporting people with some bills. And Des Moines also, people raising money for the same purpose. So this is how the way like we are responding. It's really sad because, you know, this topic, because it's not just Iowa with this situation, like I would say like Minnesota, California, Chicago, the city of Chicago, the city of Minnesota or LA, the city council put like a fund of money for these specific families. In Iowa, so far, we don't have some experience like that. So the way like we are responding is like a some specific efforts from community members and community organizations. But obviously, it's just really tiny, like a portion of help. And for example, in Johnson County, all the food like pantries, they are offering like a support in this situation with no social security. So this is in a way like we are helping these families, basically. But I think it's really unfair, and also it's so unfair when some like a person is citizen and maybe the spouse or one of the members of the couple, they are not citizen and they are not receiving even the stimulus check. I think even it's kind of like a really illegal, this situation, but this is a reality. But this is how we are responding. And then somebody has a question specific, like a one county. I have so much information, maybe not all Iowa, but I can provide a specific information about like some counties where they can call or contact for help. And in Facebook, you can go to El Trueque. I will try to type the name of my page because it's harder in Spanish.
I have it written at the end as well. So another question we have, how do you all deal with increased scrutiny of your communities on top of already facing racism and discrimination?
The thing like we are doing in the Latino community, I have seen, for example, sometimes we are using the social media, even Zoom, and trying to just talk and trying to do like, for example, some polls. What do you think about this? And that was never happened before, but now the people is sharing the experiences, like how they feel. sometimes it's like so much stress, so many times. I will find like they want to tell how they feel just be inside the house. They're afraid, like they don't have information. But just talking community, that was so interesting for us. So how through social media we having this experience right now, and it's helping. And when somebody has like a more specific like a need, we refer to somebody more professional. But talking in community how we feel is helping us so much, and sharing with everybody. I mean, through the social media, and have these like a public conversations about everything.
To the Asian community, what we've noticed is there's a lot of more of the social media, of like connecting with social media, and also like families tend to like live in one house, so therefore there's more like families who are basically coming home, who might be like from college or whatever, that we are all staying in one house, so therefore that is also a way to connect with the community. But I think one thing that specifically for my community, I'm Filipino, one thing that we have done is since I think most immigrant and refugee individuals, communities are deeply connected with our home countries, and our home countries are usually impoverished. So I think there's also a lot of like mutual aid that's like being organized by, for example, Monsoon had organized a fundraising event specifically for women-headed households in a certain two areas in the Philippines. So that's just a way for us to also connect our home countries, because our home countries are also being affected by the virus, and also there are lockdowns, and usually a lot of these women are in the informal economy sectors, and they are basically would rather like be in jail than starve, right? So for us, there's also this very transnational work that's going on when we're thinking about this pandemic.
I think for us at Proteus, we started to introduce new messaging even before the pandemic to help normalize farm workers and to bring stories to life and help people recognize that there are so many farm workers that are living in our backyards and in the shadows. Unfortunately, many of them are working sunrise to sunset 7 days a week, and they don't have the opportunity to really engage fully in the community. And so when they get home from work, they shower, eat, go to bed, and repeat. So really sharing those stories, but also helping connect people to the work that they do. And an easy one that I share each and every time I am on media is, if you eat food every day, you should be grateful for farm workers, right? So I think so many people have recently recognized the importance of the work that farm workers do each and every day, and I'm hopeful that this is something that will continue even after the pandemic, of how farm workers contribute to each and every one of our lives every single day. And they're the most hardworking, grateful people I've ever worked with, and that's another thing that I try to focus on. If people have some hesitancies of the work that we do, these are hardworking people, the most hardworking people I've ever worked with. And I grew up on a farm. I know what type of work they're doing. It's hard work, and they're also the most appreciative and grateful people I've ever worked with. So any little thing that we do, they are always so appreciative, have a smile on their face, even through all of the fear and crisis that they might be experiencing.
Thank you.
I think also I'm going to add a little bit in regard to the Congolese community, just like Daniel said, or Mira said, and Emmanuel said, the culture is different, like each culture is different, especially the African culture is very different. Coming to this country where you have to work constantly, back home, you see your family every day, you socialize, you do a lot of stuff. But before the pandemic, people had to work. Mom has to work, dad has to work, the kids have to go to school. You don't get to see each other, you don't get to talk to each other. Like the culture is different, but through this pandemic, people are coming back together again. It's like they're remembering like they were back home, the life they were back home, how they shared it, eating meals together. People who have lost their job, they're staying home with their kids, where they're actually teaching their children again the culture in the right way, because they have the time to do so. People already communicate through WhatsApp. with their families back home or other social media like Facebook and everything else. But right now, everybody's coming together since this is affecting everybody in the world, you know, like they're communicating in Congo if there's something going on here. And we have, I speak for me and my family and some other family that I know that I work with, some information that we are receiving here that's helping us stay home, social distancing, where back home they don't have the mask, they don't have the opportunity, but we're sharing with them how to do it, what to do, you know, what to use for mask that they didn't know about. So in some way, it's actually helping bring them together. The financial situation is kind of hard because people are not working to provide for their families. They don't know where to go for help. Most people used to send money back home to help their family. Right now, they're not able to do so. So it's kind of hard. The immigration is coming hard. We're helping with unemployment. We're also helping with, I think Manuel talked about immigration paperwork, where right now it's hard to get hold of anybody, to just contact them about, you know, what is the status of my immigration paperwork. It is very, very hard. But and then the Africans, they're really very religious, where everybody likes to go to church. They gather mostly at churches and parties and, you know, other stuff. And right now, because of social distancing, it's very hard to go to church, and technology where they have to watch over Facebook or YouTube. So those are challenges as well that we are seeing, but people still coming together to teach each other about those information. Thank you.
Okay, we've had a few questions about the meatpacking plant workers. So one of them is more directed to you, Bijou. Are there any resources or measures being extended to the affected Congolese families? For instance, immigrants working at Tyson Foods and Amana.
Yes, so we are, me particularly and some of the board members are working with some people that work at Tyson that's actually are affected by the coronavirus, where they don't know where to go, where Tyson is back working, where they have to go back to work. And they're afraid to go back to work because they're not sure who still has the virus and who doesn't have a virus. They don't really believe or understand that the test that Tyson is giving them is accurate. So people are afraid to go back to work and work. And the people that are staying that are affected, we've had resources where the city of Iowa City Council have provided resources for people that's affected to go and stay at the hotels, and they will be paying for it. They will pay for them to stay there for 14 days if you have the virus, while your family stay home so they do not contaminate any member of their families. Or if you're staying at home, we are sending food. We are working with the University of Iowa Medical School, where we have volunteer medical students that are actually helping as well, and other group to distribute food from the food pantries to their homes. We are talking to them constantly about, you know, social distancing and what to do if it's affected. We also helping with the bills. There's churches. There's other churches like All Nation Baptist Church that's also helping with bills if they have bills and they don't have any way to pay their bills. And there's other resources out there that's actually helping. Yes. And the Johnson County Public Health is helping with paperwork for DHS.
On this same topic, to anyone who wants to answer, do we know who monitors health and safety precautions in meatpacking plants? Are there any citizen-based watchdog groups, or are citizen groups permitted access? So whoever would like to answer that one. Okay. My understanding is that it is just the USDA that does enforcement, and I don't know the extent of it too much. I have seen some Facebook groups pop up with support for workers in meatpacking plants. I don't know if any of you all are aware of any other ones.
Well, also LULAC Iowa, which is this Latino organization, They are trying to keep tracking what is happening in these plants. And also they were thinking to do a boycott or try to work with OSHA. And so they are working in basically in Iowa and working with OSHA to do a complaint, and so they can send the inspectors and see what's happening. And another thing, as a media, I can tell you, I feel like at this, I had to be so honest, I received from some plants more like a PR announcements telling us that suddenly they are taking so many precautions, what they were doing, but that was when, they had big problems, for example, West Liberty. But this is the thing, I can tell you, I think in Iowa, LULAC is taking more leadership in that legal part, actually.
For the API community, I think that is something that is missing, is really how then we don't have a LULAC organization, how the Latino community is really creating that safety space for Latino workers, right? But for the API community, I think that is really what is missing, is how then do you organize workers who are from the Asian community? How then do you also then organize workers from different backgrounds? But we don't have that. And I think that, and for us at Monsoon, we don't have the capacity to do that. We could be part of it, but we cannot lead it because of our own capacity.
I also just want to add that Center for Worker Justice of Eastern Iowa, they are also helping, and they're not just limited to Latino, they're helping all type of immigrants and refugees, especially with the Tyson situation, and they're also monitoring and advocating for them.
How big of an issue is internet access for immigrant and refugee communities in Iowa right now?
I can take a stab at this first. So I think it's definitely an issue with broadband across the entire state, and especially as we're navigating utilizing telehealth, that is definitely a concern we have for farm workers and for the patients that we serve. So we did do a recent collaborative grant to get some additional technology into certain locations that we have a large number of farm workers at, and offer some internet on site at locations, as well as some additional iPads or other technology that they could use on site in order to access healthcare through us. But it's definitely an issue, especially right now. I think the disparities within technology have been heightened in light of all of the pandemic that's going on.
Okay, we have two more questions. First one is, how are these concerns and needs being shared and expected of those in power? It seems like immigrant and refugee populations have had to respond to their own needs because of the lack of response by individuals in power. And how can those people in power be made responsible for increasing access and other ways to respond?
I think that's the perfect question right now, looking at our leaders across the state as well as across the country and what they are doing to help protect people. And I think it's pretty clear who's in the pockets of our leaders right now, because you only hear the governor talk specifically about her conversations with the employers, and she never talks about having actual conversations with the employees and hearing their experiences firsthand. So I can't stress enough the importance of voting. And I think there's so many groups working right now collectively on creating a pipeline for more representation in positions of power. Unfortunately, it's going to take some time as we build toward that. But I can't stress enough the importance of voting. Advocacy, I think there are different types of organizations that serve different roles. Some are the bomb throwers, which I appreciate and love because they heighten the conversation and actually bring the focus to the topics that are needed. And there are other organizations that can have the maybe diplomatic conversations with positions or people in positions of power to talk through strategies in order to address those concerns that the bomb throwers raise. So it has to be a multi-pronged approach, but we have to vote.
Well, I just want to say, you are totally right, Daniel, because I think that in Iowa, one of the one of the problems is like this misrepresentation from minorities. And as always we say, it doesn't matter what we do if we don't vote at the end. That, I mean, doesn't have anything we do. I think this morning I was thinking when I was preparing this presentation and thinking that no matter what we do, but if we don't finish in the election process, we are going to have these problems again in 10 years. And it's really hard because in Iowa, this misrepresentation, you are going to find like, for example, Columbus Junction, West Liberty, Stone Lake, Marshalltown, Muscatine is a lot of immigrants and refugees, specifically Latinos, and it's hardly you're going to find minorities in power positions. So actually, again, this pandemic, specifically for Iowa, is telling us how behind we are in diversity. So we need to work and advocate for that. Just not to to have a multi different languages, everything. No, we need people in positions that we can help in the future. So I think it's another conversation, but I think representation is really, really important, at least to minimize what is happening right now. It doesn't have to happen again. And another thing is about this, the leadership, we are having again, all the minorities, the refugees. This situation is telling us again that the system is not broken. The system doesn't work. That we need to understand. And the new reality, we are having here in Iowa, is happening in all the country. And we need to start from that perspective, that we need to create a different way. And I am so happy that this situation is helping us to connect so much. Hopefully after this, we can keep doing this. But again, we need to change the dynamic and politics as well, just not community.
So I am, for some reason, that question is very top down for me, right? So for me, I think it is really important that we do more community organizing, grassroots level, because it is important that any policies are informed by the community, especially the ones that are on the margin. Anything that's policy-wise for me that is rooted from that margin will basically be a better policy. So for me, I think it is really important that community organizing, in addition to voting, is as crucial. Okay.
Thank you. Okay, that's all the time we have today for questions. Thank you all for contributing those questions. Again, thank you to our panelists, Mira Youssef, Manny Galvez, Bijou Maliabu, and Daniel Hoffman-Zanel. Their organizations are listed here, and our contact information for the UI Center for Human Rights is uichr.uiowa.edu. And thank you again. I'm going to close out now.